Welcome to Best Life University. I'm Dr. Lynn Brown, a counselor and educator. In this podcast, I discuss a myriad of topics related to the five dimensions of personal growth: mental, social, spiritual, emotional, and physical. Thank you so much for listening. Today's topic is intentional weight management, emotional eating. Emotional eating is a result of using food to cope with your reaction to a situation or an event. And the use of food as a method of coping comes from learning through experience and gratification, if only short term, that comes from eating. Ideally, food should be used as fuel for the body. However, we use food for other purposes. We celebrate with food and we grieve with food. It gives us solace, companionship, a feeling of control when we can't seem to get it from other sources, and something to do. Food calms us down, and we use it to keep anger inside. What to do instead of eating? When negative moods set in, you have three options. You can suffer through by doing nothing. You can change the situation by taking steps to do so. Or you can attempt to contain the emotion by focusing on finding ways to reduce the pain. But the thing to remember is that it is always better to do something than to do nothing. So either try to change the situation or the emotions generated by the event. Determine which choice will work best in their particular current situation. Have a goal and go for it. How can you promote situation change and improve your coping skills? First, take time for rest and relaxation. Schedule at least 30 minutes per day to do whatever allows you a change of pace. Relaxation releases the tension that interferes with productivity. Playtime is not a luxury. It is a necessity if you want to do your best and feel in control of your life. Second, use meditation as a method to enhance your mood and reduce tension. Meditation is an excellent alternative to urgent action. Focus your attention on a target, an idea, sound, or aspect of physical functioning. By focusing, you are eliminating all other stimuli and can therefore totally relax. The physiological effects brought on by meditation are the opposite of those caused by negative emotions. Meditation lowers your heart rate, oxygen consumption, and blood pressure. Do it at the same time each day. Third, train yourself to respond to negative ideas without physical tension. Learn to relax your body at will and visualize thoughts at the same time. And fourth, improve your sleeping habits. Go to bed at about the same time each night, even on your days off. Limit your caffeine and alcohol consumption. Limit your fluid intake 2 to 3 hours before bedtime. Don't do anything in bed or in the bedroom except sleep, meaning don't associate it with eating, reading, or watching television. Try to be both physically and psychologically relaxed before resting. Avoid naps. Get up at the same time each day, regardless of how little sleep you've had. And since a sleep cycle is 1.5 hours, work to regulate the length of time you sleep to 6, 7.5, or 9 hours. You'll feel more refreshed if you awaken at the end of a sleep cycle. Because sleep affects the way you feel, it has a profound effect upon the way you tend to eat. And research has found that getting too little sleep affects your ability to lose weight. Research has also found that disturbances in sleep cycles have negative effects. Insomniacs suffer from chronic tension, mild depression, increased heart symptoms, high blood pressure, and tension headaches. Many people use food to cope with these stresses, and negative moods coupled with fatigue due to lack of sleep cause many people to turn to food. So improve your sleep habits to improve your eating habits. Be sure to visit our home at bestlife21.org. Thanks. Copyright 2021, Lynn Baranius Brown.